How do we treat obesity in dogs? Well, first of all, it has to be recognized that it is a disease. It isn't just that, well, my dog is kind of chunky, but he's big boned, or he looks good that way, or there's nothing wrong. Obesity by itself is in fact a disease, and it takes recognition on your part as pet owners, but also on a veterinarian side, to recognize that obesity is a disease and that it needs to be treated just like any other disease. Again, obesity refers to actually a true gain in body fat. And there are associations of obesity with other problems, and treating those other problems, such as low thyroid function or excessive cortisol production, which is called Cushing's disease, helps to get the weight off. And then the other is to recognize that there are other diseases that are associated with weight gain that isn't fat, that it's actually fluid retention, like congestive heart failure, or if there's fluid accumulating in the abdominal cavity because of some problem. For weight reduction to be successful, it requires a team approach. And probably one of the biggest problems that occurs is that team approach isn't present. It's either thrown all back to the owner. Just feed less, feed this diet, and the dog doesn't want to eat it, but there isn't that communication and that effort on everybody's part to help do what's best for your child, your pet. So it takes the veterinarians and the veterinary technicians, nurses, it takes the owner, and it requires the pet to cooperate, which isn't always the easiest thing to convince pets that are overweight to change diet and change exercise. It's easier in dogs than in cats, though. So what are some of the things that we can do? Well, the first thing is, as a veterinarian, we actually do an obesity clinic, and so when we talk to owners and we talk to them about their child, their pet, that they're responsible. It isn't their fault that their pet became that way, but they have to be responsible because they're living with their pet, and they need to take responsibility and charge of helping to limit what goes in their dog's mouth. It helps that we see them every week or two and get weigh-ins and adjust our treatment, just like monitoring any other disease. If things aren't going the way they should, then we need to make some change in our treatment. And if things are going great, then we want to continue with what we're doing. Some things that you can do at home is don't open the food in front of your child, your dog, because then that just causes them to want to beg for food. And many people have a hard time not giving in to that begging. And again, positive reinforcement. There are a lot, in fact, when I was at another university, one of our orthopedic surgeons would tell someone they came in with a fat dog who had a knee problem. Well, just feed half of what you're feeding, come back in a month. They'd come back in a month and the dog didn't lose much weight, and then they would chastise them and belittle them and say, well, now feed half of what you're feeding now. And that usually doesn't work. What works is to say, I know you're doing your best, and most people do try and do their best, and we just need to figure out what's going to work with this particular patient. Someone asked about substituting green beans for about half the food. I will come back to that question. We're going to talk about how to change diets and why there are certain weight reduction diets out there, and why just feeding less doesn't necessarily work. So there are three different ways we can try and get weight off, not only in people, but in dogs and cats. One, we can voluntarily decrease the amount that's taken in, and this can be done either voluntarily or it can be done through drug therapy. And in people, they use something called Meridia, and in dogs, we have a drug that's available called Slentrol, which I'll come to. Also in people, they do things like banding of the stomach, and they resect part of the stomach so that you feel more full more quickly, and so you tend to eat less. We can also change how the calories are taken in. Either we can prevent digestion and absorption of some of the calories, for example, Lestra in people, or we can modify the diet so that they can take the same amount in volume-wise, but they actually take in less energy. And lastly, we can change the metabolism. And those are things like high protein, low carbohydrate diets like the Atkins diet or South Beach diet, which works great in cats, but doesn't work very well in dogs. Exercise, though, is certainly one way to increase energy output, so that you expend more energy than you're taking in. So what are some of the ways dietarily we can treat simple obesity? Well, in this cartoon, the dog says to the cat, "Today I ate 2 bowls of dog food, a sandwich crust, some spaghetti that fell on the floor, half of your cat food, a wet tea bag, 3 bugs, and the inside of a sneaker. How many grams of fat is that?" We have several dietary strategies that we can use. One is just don't eat. If you don't eat or your dog doesn't eat, they will lose weight. Now, it takes a lot to do that, and it takes a lot of willpower, and there's some potential health risks for that in doing so. But people who voluntarily don't eat anything for several weeks will lose weight. Likewise, dogs actually will do the same. The problem is, again, you're changing metabolism, but you're doing it at the expense of lean body mass and some other organ functions. And I'm going to show you that if you don't eat or if you feed less, it doesn't work very well because of the way your body down-regulates metabolism. And so in this graph, if the black line that says maintenance is the amount of energy for a dog or a person to maintain an average, whatever day-to-day they do, running around up and downstairs, going to work, or a dog running around the yard, below that is something called the resting energy requirements. And that's basically not doing any activity, just basically living. So you've eaten and you're metabolizing that food, you're digesting it, and you're using it, but you're not really expending any other energy by moving. And that's a lot less than maintenance. And how high the amount for maintenance is above resting depends on how active the dog or the person may be. The problem is when you don't eat or you eat less, your body recognizes that, and so it down-regulates its metabolism. And it goes into kind of a conservation mode so that energy expenditure goes down. So just feeding less forces the body to then use less, and so it doesn't work. You don't lose weight until you get towards the very end where the body's now so deprived it needs to work at and start using the fat that it's stored. In people, in cases where people have starved basically to death for religious or political reasons, that can take as long as 2 to 3 months. And so you don't really kind of run into big issues until about a month or so into it. And so you don't really lose a lot of weight during that time as long as you are drinking water, you don't become dehydrated. So just feeding less doesn't work because it forces the body to downshift the energy that it's expending. And what you need to have happen is expend more energy and take less energy in. You need to change that balance so that we burn off that energy which is stored as fat. Now, what we typically use in dogs from a dietary modification standpoint are high-fiber, low-fat diets. And the reason is it doesn't change the amount of food that the dog eats. It just changes the amount of energy that the dog consumes. So the energy is shown in blue and the amount of fiber is shown in red, and they're inversely related. And since fat has twice as much energy on a weight basis as protein and carbohydrates, when you restrict fat, you restrict the energy. It's an easy way to cut back on the amount of energy that's present. In the situation of, well, just take the dog food and feed, cut it in half, but give the other half as green beans, the green beans are high fiber and a lot of water. There's actually not a lot of nutrition in raw green beans. In fact, a cup of raw green beans only has about 25 calories in it. Even though there's vitamins and minerals in it, it's mainly fiber and water. The problem with doing just that is that you're substituting an incomplete food source in with a complete and balanced food. And so what you've done is you may have restricted the amount of energy coming in because you're feeding green beans, but you've decreased the amount of food that contains proteins and vitamins and minerals and salt and iodine and all those things that we also need, but you've cut it by half, and you haven't balanced out all of those other nutrients to the reduced energy intake. The therapeutic diets that are available that are high fiber and low fat are balanced to do that. That is, they eat a similar volume of food, but they're taking in less energy, but at the same time, they're still taking in adequate amounts of protein to maintain muscle mass, and they're taking in the vitamins and minerals they need for all the other things that go on inside the body. So while just substituting half of the food with anything, green beans, broccoli, carrots, or whatever, does decrease the amount of fat and they'll lose weight, it decreases the essential nutrients by half as well. Essential fatty acids, vitamins, minerals, and all the other things that are present in a complete and balanced dog food. And again, that's what the therapeutic diets are designed to do, to be complete, to be balanced to that reduced energy intake.